All right, listen, there are a slew of laws going into effect in 90 days after Governor DeWine signed this monster-sized House Bill 315 just last night.
Yeah, this, of course, is a very controversial law now. Several of these involve medical care and may impact you directly. To explain here, senior medical health correspondent Monica Robbins. Monica, there's a lot to this.
Yeah, there really is, Jay and Christy. A lot of these measures stem from the COVID-19 pandemic and the public's wish to use unapproved medications. So remember hydroxychloroquine and ivermectin that many thought would cure, treat, or prevent COVID, despite studies saying the opposite? Well, now Ohio has a law that state or local authorities are prohibited from enforcing or publicly funding any effort to implement World Health Organization guidelines. And more specifically, they can't enforce any ban on prescribing or dispensing off-label drugs used to treat conditions that they aren't authorized to treat.
You cannot ban doctors from prescribing drugs for uses that were not specifically approved by the FDA, which happens all the time anyway. This is actually an improvement over what some legislators wanted. They wanted to force hospitals and doctors to prescribe drugs anytime a patient demanded it. And I think that would have been bad for consumers, but that is not what was signed into law.
In law, DeWine vetoed the medical free speech part of the bill that stemmed from Middleburg Heights Dr. Sherry Tenpenny, whose license was suspended for 8 months by the state medical board after she told lawmakers that the COVID vaccine made recipients magnetic. Backers argued medical professionals shouldn't be punished by expressing an opinion state regulators don't agree with, but DeWine said that could lead to devastating and deadly consequences to patient health. He also said it could create a legal shield that health professionals, hospitals, and facilities could use to avoid consequences for dangerous or harmful medical care by saying it was just a difference of medical opinion. It could have also impacted medical malpractice suits. Now, coming up at 6, I'll explain the new hospital pricing law aimed at preventing you from getting sticker shock from your medical bills.
We've been hearing a lot about that. I think many of us are anxiously awaiting the implementation. Monica Robbins, live in the newsroom. Monica, thank you.
Sure.